Your feet take you everywhere, so dealing with discomfort, pain, or even injuries there can take you out of action indefinitely. These injuries can also take you down a loop where it feels like nothing ever gets better. You're out for a run, you take a step, then bam, there it is again. There are a number of issues that stem from your feet, and today we're going to go over 4 of the most common ones: Achilles tendonitis, plantar fasciitis, metatarsalgia, and patellofemoral pain syndrome. And we're bringing in the experts on this one. Lifemark Health Group is a Canadian national healthcare company that has over 25 years of experience serving across the country. They have a world-class orthotics department, and within their Richmond branch, Beatrice and Bjorgum stand out as 2 of their leading orthotists. With a wide range of experience ranging from helping amateur athletes all the way to professionals on our very own Canucks, Whitecaps, and Lions, we were very fortunate to sit down with the 2 of them and discuss these common issues and their possible solutions. We're also partnering up with Brooks Running for this video, a brand that Casey and Beatrice have had plenty of success with in the past and continue to recommend to their clients, with their ever-evolving lineup as effective as ever. We're going to head to the Richmond Olympic Oval now, an iconic Vancouver sports venue that hosted many of the Olympic events in 2010. See you there.
My name is Bee, and this is Casey.
I'm Casey.
We're going to go over some of the Brooks models that we have shown here. We are both certified pedorthists, and we fit people with custom foot orthotics and over-the-counter orthotics, and we make a lot of recommendations for footwear. And Brooks is one of the brands that we really like to put our clients into because just the fit and the comfort, and they work very well with orthotics, whether they be over the counter or custom. And so we're just going to go over some of the conditions that we see most of the time in the clinic and what shoes we refer to. Okay, so first condition we'd like to discuss with you is plantar fasciitis, which is very common in the clinic and that we see in the clinic. And some of the complaints that patients will come in with are
Heel pain at the insertion point of your plantar fascia, which is right on the inside of your heel. That pain can refer into the arch of the foot as well. And these patients typically present with flat feet or overpronated feet that roll in and down towards the ground. Typically, really tight calf muscles as well are an issue for those patients. Typical symptoms are pain first thing in the morning, like first step out of bed is very painful. Usually the pain improves with warm up, and then as the patient is on their feet more throughout the day, then the pain typically starts to worsen during the end of that prolonged weight bearing activity. So we typically will assess the patient's gait cycle. We'll watch them walk to see what mechanically might be influencing these symptoms. And then we design an orthotic to help to control those mechanics. And we want the best shoe possible to be a good base of support for the body and for the orthotic.
the first shoe we will go through, it will be the Brooks Ghost Max 2, which is, if you see on the bottom, it's a very good base of support, and it's very torsionally stable.
Feel a tangible endpoint when you manipulate the shoe. Same thing across the forefoot. So we really like this rockered shoe design because it de-stresses the foot really effectively. We like this rocker shoe a lot because the rocker is further back in the shoe. So for a lot of clients, it helps them to feel more stable, and yet it really cushions heel to toe really effectively. Width through the midfoot is really good. There's lots of ground contact through the midfoot here, which for an overpronator is really important. We don't want the foot spilling over the midsole of the shoe. So the shape of this shoe is really ideal for that.
Another thing is that the heel counter of the shoe is fairly deep. So if we do need to put an orthotic or an over-the-counter insert inside, there's enough room for the orthotic to sit in properly. We just remove the sock liner and we will place the orthotic or the over-the-counter insert inside.
So a couple of non-rockered options that we like to refer for are the Glycerin GTS, as well as the Ghost. So the Ghost Max 2 is a great option for those who like the feel of a rockered shoe. Some patients prefer a non-rockered option. They might feel their balance is a bit better in this style of shoe. The Glycerin GTS, again, has a nice wide base of support through the midfoot, so a nice straight last, great heel counter control, removable insole, and it has guide rail support on the medial and the lateral side, so inside and outside. And especially for severe overpronators, this is just a nice little bit of added control that the shoe provides, in addition to what the orthotic or the over-the-counter insole might provide. And additionally, the Ghost 17 is a nice neutral supportive option, really good cushioning through the rear foot and good durability to the foams in Brooks shoes overall.
So, next condition that we'd like to discuss is metatarsalgia. It's really just a general term for pain, either along the metatarsals or along the ball of the foot. And one of the conditions that we see a lot of are bunions. And bunions, what you'll see is a growth coming on the side of the big toe. You can have medial bunions, which are on the side, or you can have dorsal bunions, which is on the top of the joint. Okay. And so a lot of individuals that have bunions is quite painful. And with walking for extended periods of time, it can cause the joint to become very painful. So shoes that can address the metatarsalgia, specifically for bunion pain, we would like to see individuals go into footwear that is wide enough in through the forefoot. So Brooks has your regular width and wide and extra wide that can accommodate for the bunions. And normally the bunion will hit around where the first eyelet is here, and this area comes in different widths, so it can accommodate the bunion, whether it be medially or dorsal, and it can also accommodate an orthotic, whether or not it be custom or an over the counter. So, comfort wise, it can be much better in a shoe that has a rocker that can allow you to pivot off the ball of your foot faster. Another condition of metatarsalgia are neuromas.
Morton's neuroma is a thickening of the nerve sheath that runs in between each of the metatarsal heads. So, as the metatarsal heads rub together, the sheath of the nerve thickens more, and that creates a shooting pain and numbness into the lesser digits. It's more commonly seen between toes 2 and 3 or between toes 3 and 4. For Morton's neuroma, an orthotic is typically paramount in treatment of this condition, as the metatarsal pad that's added to the orthotic will help to unload the ball of the foot and separate the metatarsal heads such that you don't get the same amount of rubbing on the nerve. Similarly, shoe fit is really important as well. It's really important to have a wide fit through the forefoot so the foot can splay properly within the shoe so that you are not getting compression of the metatarsal heads when you're wearing it. So again, the wide and extra wide options that Brooke offers is really handy to have from a referral standpoint. And again, the rockered aspect of the Ghost Max 2 is another component that will help to further de-stress the foot and address pain.
One trick that we have for individuals that have one foot larger than the other, or one foot that's wider than the other, one foot may fit perfectly in like a size 7, and on the other side it's just a little bit tight. We suggest that individuals skip this eyelet and start lacing the shoe on the second eyelet. So then they'll get a little bit more space in through the forefoot and decrease the pressure along the metatarsals.
One other aspect that we really like in the Ghost Max 2 is that overall this shoe is considered a neutral shoe. So in this respect, the shoe is not competing with what we are trying to do with the orthotic. So it allows the orthotic to do its work, and the structure in the shoe is not creating any additional forces that we need to worry about when the patient walks.
We definitely do not want to overcorrect with an orthotic. And so the shoe is very important to work with the orthotic. So neutral shoes are strongly recommended with an orthotic, whether it be a custom or over the counter insert. So the next condition we'd like to discuss is Achilles tendinopathy. Normally symptoms patients will come in with is pain at the insertion of the Achilles tendon at the calcaneus. Sometimes we'll see swelling around the insertion spot, and there's tenderness on palpation. So when we touch along the Achilles tendon, patients will show discomfort. For example, an individual came in presenting Achilles tendinopathy, and this individual had a very high arch foot and a very rigid foot structure. So, typically a poor shock absorber, and it was a very hard heel strike followed by a foot slap. So the whipping action of the foot going across the arch area has caused a lot of irritation of the Achilles tendon. Ideally, we would like the heel to sit in a neutral position, so not rolling outwards, not rolling inwards. And with a shoe that can has a stiff counter that can hold the heel in place will help reduce the symptoms along the Achilles tendon.
So from an orthotic standpoint, our goal is, as B said, to control excessive mechanics through the rear foot or the back of the foot. And as such, we want to pair the orthotic with a shoe that has a heel drop that is not exceedingly too low. So the Adrenaline GTS or the Ghost or the Glycerin GTS are all really good options, as their heel drops are 10 millimeters and 12 millimeters respectively. So these shoes have a firm heel counter that will control rear foot motion in addition to what the orthotic is trying to control, and just a nice stable base of support to follow through to toe off. Additionally, you want to make sure that these patients are doing soft tissue work to release any tightness through the posterior chain as well.
The guide rails, like individuals that have a pes catus, that they typically sit in a varus position, and so their heel is rolling out. The guide rails, it helps stabilizes the heel, so it doesn't allow the foot to over supinate or over rotate laterally, going to the outside to the baby toe. So even though individuals that have low arches, we will put them in an adrenaline. Somebody has a high arch foot, I'll still put them in an adrenaline also, because the fit around the heel, especially for women, I find it fits really well when they have a small heel and they have slippage. Their heel feels like it's popping out. I find the adrenaline with the cushioning that they have in the heel counter, it just holds the heel down. And they also have the extra eyelet, so then you can lace it up higher up on the foot and hold the foot down. So with patellofemoral pain syndrome, the kneecap, which is the patella, it sits right about here. This is the left knee, and the patella will sit about here. The kneecap, what can happen, it can shift side to side and it can cause an irritation of the patella against the end of the femur. And with that excessive movement, that can be caused by either poor hip stability or poor foot stability. And those forces are translated up towards the knee. So when you have knee pain, you have to look above the knee joint and below the knee joint to get to the root of the problem. When we see individuals that will have patellofemoral pain syndrome, during their assessment, we'll typically see the knee go into valgus. We'll see the knee turn inwards. So this is the left knee. We'll see the knee turn like this. And that excessive movement repetitively will cause an irritation to the patella. Shoes can be very helpful in controlling this movement.
So the shoes that we will typically recommend for patellofemoral pain syndrome is one that has a firm heel counter to control rear foot motion. The goal of an orthotic, and as an adjunct to that, the shoe, is to control, for example, overpronation, which can lead to an excess of rotation up the kinetic chain, up the tibia, and then that can, as B said, lead to improper tracking of the patella. So to control rear foot motion, the Ghost is a really good option. Very stable through the rear foot. It will keep the foot guided properly at heel strike. Additionally, we might go with the Glycerin GTS if we wanted a bit more of the support to come from the guide rail system, or the Adrenaline GTS as well would be a nice option for that.
So overall, when people come to see us, I find they come in with cut. Okay. Um, I find a lot of individuals that come in with either foot pain or knee pain, uh, they come in with shoes that are way too old. They hold on to their shoes way too long. They think the shoes are supposed to last like 3 to 5 years, when in reality, shoes, if you're wearing shoes, the same shoes day in, day out, anywhere between 8 to 12 months.
We know with
And
Brooks, though, that people are going to get that 8, 9 to 12 months out of their shoes. And that's one of the reasons we recommend Brooks so much, is we know the durability is going to be very good with Brooks shoes. So we know patients, they're investing in a high quality shoe that will last them.
Thank you so much to Casey and Beatrice for providing plenty of insight on very complex issues. Of course, the solutions put forward by the two of them are recommendations based off of what has worked for them in the past, but they're certainly not one size fits all. To truly tailor a solution to any foot or ankle injury, your best course of action is to visit a specialist like an orthotist, have them assess your body, and make a recommendation from there. Then you can go to a specialist retail store like Rackets and Runners and have them professionally fit you to the shoes that were recommended to you. Thank you so much for watching. Hopefully we'll see you in store soon, although as injury-free as possible. And of course, if you want to check out any of these Brooks shoes online, you can also do that on our website, racketsandrunners.ca.